All right, guys, I'm gonna talk to you next about another form of cryotherapy, and this is just a simple ice bag. So what we're gonna do is I have my ice machines behind me, I have my ice bags here, and we're just gonna make a very simple ice bag, and I'll try and show you guys how to do that. So first off, we're gonna take one ice bag, and I'm gonna come over to my ice machine. And I'm gonna scoop one scoop of ice into my ice bag. Now we have two different types of ice machines here. The first one is gonna be this. It's like a crushed ice, so very fine ice. The other one is a cubed ice machine, and I use that for the ice bath. So I like using this crushed ice for the ice bag better because I feel like I can get it forming to somebody's body better, where the cubed ice kind of hurts them a little bit more. It might poke into them, and it's not gonna mold to somebody's body as easily as this crushed ice is gonna do. So once I get the ice in the bag, what I like to do is get it up against this counter or table or whatever, and I'm gonna flatten it out. So I'm gonna get this pretty flat. And obviously you're gonna make the ice bag to the size of whatever body part you're icing. So if we're icing somebody's finger, I'm gonna make a very much smaller ice bag. If I'm icing somebody's quad or hamstring or some larger part, right, a big chunk of their back or their shoulder or something, I'm gonna make a bigger ice bag like this. And then in between, if it's maybe an elbow or a wrist or a knee or something like that. So I'm gonna flatten this ice bag out. I'm gonna open up the side of the ice bag and kind of put like a opening kind of right here in the, where I can kind of get air out of it. And then I'm gonna suck the air out of this bag. And then I'm gonna pinch with my hand to get it tight, and I'm gonna twist it and then tie it off. So again, I want this bag pretty thin. I don't want it really thick, because if I have a really thick ice bag, all this ice up here, when I put it on somebody, isn't really touching their skin, so it's not really getting super effective as far as, you know, putting cold into their body. So then what I can do is, like I said, this is very moldable, right? So I can put it on somebody's shoulder, and I can mold it all the way around their arm, or I can mold it around their elbow or something like that. And then what we have also is this flexi wrap, and I could wrap that onto somebody's body part or whatever the case may be, and they can kind of walk to their car or whatever they have to do. Again, this is cryotherapy, cold therapy, so I don't want to do this before practice or before a game because it's going to tighten up all their muscles. What I want to do is use this after practice or after a game to help decrease inflammation and possibly decrease pain in the area that the person has discomfort. So again, this is the simplest form of cryotherapy, but we want you to be able to make a really nice, clean ice bag in the athletic training mirror. Hey guys, so this is an ice bath, and this is one form of cryotherapy or cold therapy. Other than like an ice bag or something like that, this is going to be a little bit higher level than an ice bag. It's going to be a little bit more difficult to set up and things like that. But an ice bath typically works in the same exact way as an ice bag does, but instead of making 15 ice bags and putting them all over somebody's body, I can make one ice bath and let them sit in it, whether it's all lower extremity or even from the neck down. So I'm going to show you guys real quick how to set up an ice bath. So first thing we're going to do is we're actually going to find this knob right here, and I'm going to push this down, because what that does is closes up the drain so the water doesn't come out of the ice bath. Then I'm going to turn on the water. And now the water's flowing, and I'm going to fill this ice bath up as far as I need to. So it's going to be different for each person, right? If somebody's only going to go lower extremity or maybe just shins, I don't need to fill it up as high because they just need to sit and get their legs in it. Now if they're going to go up, they want their whole body immersed in the ice bath, then I'm going to fill it up a little higher. It also depends on how big the athlete is, right? Is it a small cheerleader, or is it a big lineman football player, right? So everybody's going to be a little bit different as far as how much I need to fill up this ice bath. So once I've got the drain closed, once I've filled it up with water, then I'm going to check my temperature right here, my thermometer, and I want to get this ice bath between 50 and 60 degrees Fahrenheit. That's, to me, a perfect temperature for an ice bath. Now, you are going to get some athletes that are very used to ice baths. They do them more often, and they might go a little bit colder, and that could be okay. Somebody who's new to an ice bath, I typically don't get them under 60, maybe 55 or 60 degrees to get them kind of acclimated to what an ice bath feels like. At the same time, I'm only gonna put somebody in ice bath for about 5 to 10 minutes. Maybe somebody who's done it for a long time and is kind of in that middle range of still at 50 or 55 degrees, maybe up to 15 minutes, but really no more than that. Again, their whole body's immersed in ice water, so I don't want any complications or anything due to a modality that we're giving them. Now, once I've kind of got the drain down, once I've filled it up with the right amount of water that I need to start putting ice in here to get it to the temperature that I want. So I can either take a cooler and dump the ice in, or I can start getting my scoop of ice and I can start dumping ice in. As much as I need, and I'm going to be checking the temperature periodically as I'm doing this to see to get it to whatever temperature I want it to get to, whether that's 60, 55, 50, whatever. So that's how I'm going to basically set up my ice bath. Once I get it to the temperature I want, I'm going to have the athletes either on their phone or on one of our timers get in the ice bath and start a timer until it's over. Now what's going to happen is once they get in the ice bath, it's obviously going to be cold. But what happens after a couple minutes is they typically don't feel as cold. It actually starts to feel okay for them. And that's not a bad thing, but we want that coldness getting into their body. That's the whole idea of cryotherapy. So what happens when you're sitting in an ice bath, very still, is like the very small amount of space all around your body's releasing this heat into the water. So if you actually took your temperature, your thermometer, and took it away from their body, say you set the ice bath to 50 degrees, the water would be 50 degrees. But if I can actually get that thermometer right up against their body, that temperature of that water within like ½ inch or 1 inch of their body actually sometimes is a little bit warmer because we are getting our body to push out heat into that area. So then what I can do is on top of this machine right here, there's this little knob, and I can push this over, and what it does is turns on the jet. There's a jet on the bottom that basically pushes air and circulates that water around the athletes. Typically, whenever I turn this on, they immediately feel the sense of like the ice bath got colder. And it's not that the ice bath is getting colder because I turn on the jets, but the water is actually circulating around them, so that cold water and the warm water is mixing and they're not just feeling that warmish water around their body because they sat so still for 10 minutes. So circulating that water is actually going to make it a more effective ice bath. And again, this is another form of cryotherapy that typically you're going to use after practice or after a game to decrease inflammation or help decrease pain or soreness in one of your athletes. Hey guys, so the next modality we're going to talk about today is the game ready. So this is a cryotherapy modality. It's going to help decrease pain, decrease inflammation through compression and ice. I've already kind of taken the liberty of putting some ice and water in the back compartment. So what we do is we put ice and water in the back. It has lines where you put ice to here and water to here. And we always want to use the cubed ice, the bigger ice, because the small ice can get stuck in the hose and mess up the machine. So we always want to use the cubed ice. So I'm going to put it in the back of the chamber. I'm going to close that up, put it back here on the table, and I'm going to plug it in and turn it on. And then what I'm going to do is lay on the table, and let's say I have an injury on my knee again. I'm going to take the knee sleeve, and we have sleeves for pretty much every body part, but I'm going to take the knee sleeve, and I'm going to go ahead and put my knee and leg inside of this, and it's just Velcro, so kind of put it in, and Velcro it as tight as you can shut. And then what I'm going to do is go ahead and grab my hose attachment, and I'm going to take one end of the hose, and I'm going to plug it into the machine. And I'm going to take the other end of the hose and plug it into the leg attachment itself. And then on the game ready itself, it has a couple parameters that we can choose. One is going to be the duration time. So right, do I want a 5, 10, 15, 20 minute session? Typically I like to do very similar to other cryotherapy, like an ice bag. So typically somewhere in the 10 to 15 or 20 minute treatment for this, depending on how cold we do it. The second parameter is going to be pressure. Very similar to the Normatec, this is going to fill up with air, so give my knee some compression to decrease swelling. So I can do low, medium, or high air or pressure. And then the third thing I can do is I can set the temperature. So there's like a knob right here, and I can set it anywhere from 50 degrees Fahrenheit down to 34 degrees Fahrenheit. Typically I put it on the coldest, but you can adjust that per athlete. Once I get my parameters set and all this set up, I'm just gonna go ahead and click play, and then it's gonna do its thing. So what it's doing is it's taking the ice water from the back of this chamber, and it's flowing it through this hose, and it's circulating it through this attachment on my leg. So it's pumping cold water, circulating my entire leg or knee, and then at the same time it's gonna fill up with pressure to decrease inflammation. So it's decreasing inflammation and decreasing pain, just like other cryotherapy modalities that we've talked about before. Hey guys, I'm here now to talk about my combo unit, and first off we're going to talk about electrotherapy or E-stim. So I have a lot of settings on this machine, so the first one I'm going to talk about right now is going to be E-stim. So I'm actually going to hit the electrotherapy button on my machine, and then I'm going to pick, I'm picking interferential. I'm not going to get into like all the details of all the different parameters and everything right now. I just kind of want you guys to get used to like what these modalities are and kind of the basics of what they do. So I'm going to click on interferential, and then I'm going to set my time for about 15 or 20 minutes. So I'll set it, go ahead and set it for a 15-minute period of treatment. Then what I'm going to do is I'm going to take my electrodes. So I'm going to open up this bag, and I'm going to go ahead and get my electrodes out, and they're just kind of sticky patches, right? They look like sticky squares with a cord kind of coming out the end. And what I'm going to do is I'm going to imagine like I have a knee injury. So what I'm going to do is I'm going to say it's right over my patella. So what I'm going to do is take these 4 electrodes, and I'm going to try to make a box around my knee. So I want the injured site to be in the middle of those 4 squares. So I'm going to put 2 squares below my patella, and I'm going to put 2 squares above. 2 are on the medial side and 2 are on the lateral side. Then what I'm going to do is I'm going to take these electrode wires, so these leads, one of them's blue on this case and one of them's green on this case, and we have 4 on this machine, so we can do 2 people at the same time. And sometimes it depends on what kind of setting you're going to do, but I'm going to take these leads, and this blue one, I'm going to do opposite corners. So I'm going to do my lower left pad, and I'm going to do my upper right pad. Because I want those 2 pads to cross at an angle over my injured site. Then I'm going to take my green lead, and I'm going to do the same thing. I'm going to put one on my upper left, hook it into the pad, and then the other one on my bottom right. So again, now it's going the other way. So those 2 leads are going this way, and they're creating like a little vortex over my injured area. Now what I'm going to do is I'm going to turn this knob to increase the intensity or the amount of electricity that's going to go into this knee. So typically what I like to do to start is go kind of fast and tell the athlete to tell me when they actually feel anything. So I'm starting to feel something. It's not much, but I'm starting to feel something. So once the athlete tells me, okay, I'm starting to feel something, then I'm going to slow up on the intensity, and I'm going to go a little slow. And now I'm starting to feel like a tingly sensation. It kind of feels like pins and needles all over my knee. So again, I'm going to go slow until I get it to the point where I like to tell the athlete, you're going to feel an intense kind of tingly sensation, but I don't want it to be painful, and I don't want your leg to be twitchy, like your muscles are spasming. Once I get to that point where they really are feeling that pins and needles kind of tingly sensation, but their muscles aren't contracting and they're not in any pain, then I'm going to go ahead and push start on the machine, and it's going to start my countdown for their treatment. Typically I'm going to have somebody here for about a 15 to 20 minute treatment, and again, stim is going to be a pain management. What this is doing is these pads with this tingly sensation is kind of tricking my nerve endings that are going to my brain to feel this tingly sensation and not feel this pain sensation. So if the whole idea of this is to decrease pain, what I can also do is take an ice bag and I can put it right on top. Because what does an ice bag or cryotherapy also do? This is also to decrease pain and inflammation. So this is a good tool after practice if somebody has a chronic injury that they're gonna try to decrease pain and inflammation after practice, they can do a 15 or 20 minute session of E-stim and ice. Hey guys, so the next modality we're gonna talk about is ultrasound. And I'm not gonna do it over my stomach. This isn't a screen where we're gonna see any kind of baby or anything like that. This is therapeutic ultrasound, and this falls under the thermotherapy category. So for some small area, like maybe my patellar tendon right here, let's say I'm an athlete and I have patellar tendonitis because I'm running a lot. And it gets very tense and tight and painful on my runs. What I can do is use ultrasound to ultrasound my patellar tendon prior to practice or prior to a game to loosen up that tendon so it isn't so painful, and it's kind of like I'm loosening it up and stretching it out. And I could literally do this ultrasound and then have the athlete stretch right after to loosen up that even more. So I'm gonna kind of get into a little bit of what ultrasound is and how to set it up real quick without getting too in depth of the parameters of ultrasound. So on my machine here, I'm gonna go ahead and click ultrasound. And then I'm gonna go ahead and set it for a 5-minute session. Typically I'm somewhere in the 5 to 8 minute session range is my typical treatment time. And then I'm gonna go ahead and set the parameters of where I want it to be. I'm gonna set the intensity and the megahertz. And then I'm gonna go ahead and grab my ultrasound wand. So it's this little wand right here. And before I kind of get into that, I always wanna use ultrasound gel. So I want to take this gel and just put a little bit of it on my patellar tendon where I want to do the treatment. And then what I'm going to go ahead and do is get this ultrasound wand and I'm going to kind of spread this out over my patellar tendon. So the ultrasound gel, what it does is helps get the heat from the head of this wand into my patellar tendon. So what I'm going to do is kind of spread this out a little bit over my patellar tendon, and then I'm going to go ahead and start making little circles. So when you do this treatment, what you want to do is do about 1 circle per second, and you also want to do 1 circle about the size of the diameter of the head of the ultrasound. So I'm doing it about this size of circles, and I'm doing about 1,000, 2, 1,000, like 1 circle per second approximately. So I'm going to kind of start that process, and then I'm going to push play right here on my ultrasound. And then you're gonna see the light turn on the top. That means it's actually working. Now this modality, you don't feel a lot, but it is a thermotherapy. So we don't wanna keep this ultrasound head sitting in one place for too long because we can actually burn the patient. So we wanna keep it moving. And again, 1 circle per second about the size and diameter of the actual ultrasound wand. And I also don't wanna be lifting it up and down and moving it, right? I wanna keep constant contact with that person's skin. And it's a small treatment area, right? I'm not gonna ultrasound somebody's entire hamstring. If I was gonna do that, I'd maybe do like a heat pack or get them on a stationary bike or have them go do a warm-up lap. And I'm gonna use this typically for like patellar tendonitis, maybe tendonitis of the elbow, golfer's elbow, tennis elbow, a smaller area to warm up and loosen up that tendon pre-practice or pre-game. Remember, we can also use ultrasound to break up scar tissue, so I might do that over a hamstring strain, like a specific area, later in the rehab process or something like that as well. Once my treatment ends, then I can go ahead and lift this off and clean everything up and move on with their rehab or go to their practice or stretch them. So if it's a patellar tendon, I'd get them to stretch their hip flexor and their quads before they get out to practice or their game. Hey guys, I'm here next to talk about the modality of low-level laser, and it's on this same machine. So what I'm gonna do is I already have my parameters set up on my machine. I clicked on laser and set up the parameters. So what I'm gonna actually do is get my safety goggles on, these very fashionable glasses. And what this is gonna do is help the laser beams not kind of get in my eyes. We don't want the laser to get in eyes, so typically the athlete and you that are going to be performing laser are going to both be wearing these glasses so we don't injure our eyes during the process. So I'm going to go ahead and grab my laser here, and then what I'm going to do is got my parameters set up, so I'm going to go ahead and start my treatment. And then once it's kind of armed, it says on the machine, there's a button right here on the laser that I can actually start the treatment. And you can see it's similar to the ultrasound one where it has, if you kind of look right here, it has a bunch of little lasers on the inside. So I'm gonna take this, let's say I have some shin splints on my medial side of my lower leg or my shin. I'm gonna take this laser and I'm gonna put it on a specific spot. I'm gonna push down and put some pressure, just a little bit, and then I'm gonna push this button right here on the top of the laser. And you're gonna actually see like the red of the laser kind of turn on. So treatment time for each one is gonna be about a minute for that specific area. And lasers come in different head sizes, so you can do smaller or bigger treatment area at a time. But I kind of don't want to look directly at it, and I'm just gonna sit here for about that minute and let the treatment go ahead and go. Again, what this is doing is it's having the lasers hit the cellular level, and it's altering cellular function just enough to kind of produce more ATP and basically make those cells work harder. And as they're working harder, they're basically trying to get that injured area to heal a little bit faster. So we can kind of do this on almost any body part or injury to kind of increase healing time. And now that my minute is just about up, the machine's gonna beep and the laser's gonna turn off, and then what I can do is I can kind of move up to the next area, and I can go ahead and push this button on top of the laser and start that next treatment. Hey guys, so next I'm gonna talk about rolling or massaging. Now I have a bunch of different types of rollers here, right? We can physically do like a manual massage on somebody or physical treatment on them with our hands. But these are some devices or rollers that we can use to do the same effect. So whether it's getting a knot out or stretching a body part, we can use a couple different things here. So the first one I have here is a roller, but this one's kind of has some bumps on it, has some different grooves on it. So we can get into right my quad, or I can get into their calf or their back or their hamstring or whatever, and I can literally hold this and I can roll over the body area, and I can roll out their muscles and stretch out their muscles or roll out a knot. Just like this one, I have this other roller that's very straight, so it's not going to be so bumpy and kind of dig in as much. So this is going to be more of the beginner roller. And again, I'm going to hold the sides and I can go over right a quad, I can go over get my calf, do a calf, I can do a hamstring, a back, you know, whatever the case may be. And I'm going to stretch out that body part using one of these two rolling devices. I also have this one that's called a foam roller. This one's a 1 foot foam roller. We also have 3 foot foam rollers. But what I can do with the foam rollers is I can put this on the table, get something like my calf on top of it. I can hold myself up and I can roll my calf on top of the roller. So I'm using my body weight to use this as a stretching device or a spot to get out knots, right? If I had a big knot in my calf, I can put this under there, kind of use my body weight to have my knot push down on this foam roller and release that knot out of my calf. Similarly, I have this ball. I can do the same thing. I can put it on the table, get my calf on top of it, and I can put my body weight and maybe even roll over the top of it, or just stay in one position and I use my body weight to kind of get out knots. I can also, this is very good for like your back. I can get this into like some tighter spots than I could a big roller like this. So I can lay this on the table, I can lay on it on my back and I can roll my back around, or I can put this up against the wall, right? I can put it up against this, get my back, and I can move around, right? We get a lot of knots right underneath our scapula, so I can kind of dig into that area and kind of get a knot out or stretch out an area that I want to with this. And lastly, I'm going to talk about, we have some hypervolts, or sometimes we have different devices called Theraguns. And what we're going to do is turn these on, and then you push the button, and what happens is the end of it oscillates. So it's moving back and forth, and I can actually use this to kind of go over my quad or calf or whatever body part, and I can stretch out that area, knots, whatever, with this hypervolt. My athletes really like this a lot. We have a couple of them in our athletic training room. So it's a very popular item around here. So again, these are mechanical devices or rollers that we can use to either get knots out of somebody or massage their muscles out from soreness, or we can just stretch their muscles, right? They have tight muscles, and instead of just doing a normal stretch, we can actually roll that and lengthen those muscles out for them. Hey guys, the next modality that we're talking about is Normatec. It comes with this Normatec machine as well. So Normatec is going to be under the modality realm of massage, kind of like the foam rollers and things of that nature. But what this is going to be is I'm going to actually take my shoes off and I'm going to get my feet inside of this big sleeve and I'm going to go ahead and zip it all the way up my leg. And I'm going to go ahead and do the same thing with the other side here. So I'm going to get both legs inside of these leg sleeves. And now these also come with hip sleeves and arm sleeves. So I can do my arms, I can do my hips, and I can do my legs. Now what I'm going to do is take the connector, and the double side of the connector is I'm going to actually take the hoses out of each leg and I'm going to plug them in to the connector on both sides. So my left leg and then my right leg. Then I'm going to take the other side of that connector and I'm going to actually plug it into this machine over here. And then I can set my treatments. Typically it's going to be a session time, 5, 10, 15 minutes, and then a session power level, anywhere from 1 to 10 power level, which is just going to be how high this thing fills up. So I'm going to go ahead and push start on it. And what it's doing is it's going to, this is pretty flat right now, but as you can see over the next minute or so, this thing is going to fill with air. And then it's going to start at my feet, it's going to fill up, and then it's basically going to massage its way up. So it's going to fill up here, then here, these different sections up the leg on both of them at the same time. So it's almost like a milking effect, where I can feel it in my legs right now getting tight. So that's what I mean by a massage effect, where it's actually kind of massaging kind of the legs up towards the body, and it's kind of milking that swelling or that soreness and trying to get that out of the way. So I have a lot of basketball players, cross-country runners, track athletes that really like Normatec, and they like to do it after a big race or after a big practice or even the day before a big meet. This is a recovery tool, and again, a recovery tool for lower extremity. A lot of times, again, it's runners, but I do get some basketball players, volleyball players, football players that like it too, but a lot of the cross-country and track athletes really like it. So it's a recovery massage modality that we can utilize inside the athletic training room. Hey guys, so the next modality we're going to talk about today is cupping. So I have two different types of cups, but first off, if I'm going to do cupping, I'm going to use this Free Up kind of unscented massage lotion, and I'm going to open this up and I'm going to get a little bit of it on the body area that I'm going to cup. So I'm just going to rub this in so it kind of can glide a little bit easier over the skin and not get so stuck over the area. So right now I'm just going to show a demonstration of cupping on my quad muscle. So then I'm going to take my cup and the little cup gun, and then what I'm going to do is put this cup into the gun like so, and I'm going to take the cup and put it over my quad, and then I'm going to pull this trigger to get it tight into my quad. I don't know if you can see it, but I can see the skin kind of sucking into there. So what I can do is either leave this here for about 5 minutes, or I can do a little bit longer duration of a treatment, so maybe somewhere between 5 and 10, and I can go ahead and move it, glide it with that massage lotion across my muscle. And again, treatment time is going to be about 5 minutes. If it's still, maybe 5 to 8 minutes if you're moving that cup. The idea behind cupping is going to be reducing or getting some knots or adhesions out of the area or increasing blood flow to that area. So in a sense, it's kind of like a massage modality. It can also be kind of like a thermotherapy modality, where I can get blood flow to that area to maybe increase healing or increase blood to that area for whatever reason. Or I can kind of do it, we use it a lot in traps and upper backs to get knots out of somebody's muscles because they're tense or tight or whatever from maybe swimming. Our swimmers and our polo players, water polo players like the cupping a lot. So we get it with a lot of the water sports that are doing this constantly all day long, swimming and stuff, and getting a bunch of knots in their back and in their shoulders. Another set of cups I have are these rock tape cups. So they're silicone cups. And what we can do is do the same thing. We can put them on, but now we just push down on the top of it, and it creates a little suction on it, and we can just leave it there for about 5 minutes or so. And then when I'm done, I can just pull that off to undo the suction of, it's just a silicone cup. So again, it's gonna act as the same way. We're going to decrease adhesions or knots, or we can increase blood flow to that area.